For 9.1, the size and shape and uses of various suture needles. We have this little diagram here of different types of suture needles. We have first the taper point needle, which has a sharp point on it but a round body. Taper point needle has a round cross section. It can penetrate tissue easily without cutting the point of insertion at all. It's best used when a sealed suture line is needed, like suturing an intestine or other hollow organ. It can also be used for fat and muscle. A taper cut needle here does have a sharp point, but it also has 3 cutting edges that taper away into a round body. The needle is used for tough fibrous tissue and some cardiovascular procedures. The reverse cutting needle here has a sharp point and 3 cutting edges. It has a triangular cross section, and the outside curve is the cutting edge. A regular cutting needle is similar to the reverse cutting. It has 3 cutting edges, but the innermost innermost curve, the inside of the curve, is actually the cutting edge on this one. It's potentially most traumatic since the curve of the cut is towards the wound. It can be used in tendons, ligaments, and skin, but not in anything like the urinary bladder or intestines or lungs. Same goes for the reverse cutting. You can use that in tendons, ligaments, and skin as well. There are 2 types of needles. Actually, before I go into that, these needles, there are 2 types of needles. There are the eye needles and the swag needles. Eye needles look like your common threading needle. You would thread the suture material through that. One problem with that is that point of where the suture goes into the needle tends to be larger than the needle itself, so it becomes a point where when you're inserting the needle through the tissue, it can catch there and cause a little more trauma to the site as you're passing through there. The other type is a swagged end needle, where in the process of making the needle and the suture, the needle is made onto the end of the suture material. So it's like the suture's in a little hollow tube of where the needle ends. All the suture material we have has these type of needles on it, and they come in various sizes. Like we have monocryl. It comes in both a taper and a reverse cutting type of needle. Sizes come from anywhere from a 20 to a 2. 20 is the smallest and 2 is the largest.